Hi, everyone. This is Nathan with People's Town Hall. Welcome to another virtual community conversation. Like all of you, I'm sure we are very eager to be back doing in-person events soon. But for the duration of our public health crisis, we are hosting virtual town halls, and we're doing our best to capture what is so great about a town hall, facilitating real, organic, substantive conversations. We are excited to be here in Oregon again, in Washington County, Oregon, with Senator Ron Wyden, who I'll introduce in a moment. But I would ask those of you watching on Facebook, watching on YouTube, to share this event. We want to make sure everyone who's interested in participating in this conversation, especially people in Washington County, are aware of it. So if you're in Washington County and you're watching on this gray-ish Saturday, would love for you to make sure your fellow community members are aware of it as well. We do have some folks here live on the video who are going to be asking questions of Senator Wyden. We do hope to get to a few of your Facebook comments, questions as well. So if you have a question for Senator Wyden and you're watching, add those in the comments and we're going to try to get to it. Senator Wyden, thank you so much for joining us today.
Nathan, thank you for doing this. And for those that are attending a town meeting for the first time, this is part of the pledge that I made back when I was chosen Oregon's first new United States Senator in 30 years. I said I would have an open, in-person town hall meeting every year that I have the honor of representing Oregon in the United States Senate. So I held 970 in-person town hall meetings before the pandemic. And in choosing how to proceed, we have created what we call virtual town hall meetings, thanks to People's Town Hall and Nathan and the great work they do. And what I do is I go out to the county. So I'm physically present in Washington County. I'm at the Beaverton Library. And we're going to take your questions. And this will be 999 in terms of the list of counties I have been physically present in. And I'm just looking forward to being back to the days when we can do these in person and everybody can look you in the eye and have a really natural, spontaneous discussion. Obviously, there is so much going on right now, so many important national and international issues that I'm just going to spare the speechifying. I think that what we always try to do in these sessions is practice what I call the Oregon way, is just look for good ideas and practical suggestions for making our state and country a better place. So we use that as kind of an opening salvo, and thank you all. It's a cold late winter day here in Washington County, and I just appreciate everybody participating. Let's go right to your questions.
Great. And we have selected a range of topics from all the great questions submitted. We do not ask people's party affiliation. We don't ask who you voted for. We don't even ask if you voted at all. So hopefully we just have some great substantive questions for Senator Wyden. First up, we have Lisa.
Hi, Senator Wyden. Thank you so much. And thank you for selecting my question. Thank you for the work you do in Washington for us. You are one of my favorite senators of all time.
Thank you.
So buttering you up that way. No, I think you're amazing. We've all been watching the news about Ukraine, and especially in the last day or two, is extremely scary. So my question to you is, maybe it's a two-part question, what influence or what part does the Senate or Congress play in the decision about our response? And how concerned are you about the fact that there does look like an invasion is going to happen any second? Do people realize that the Russian separatist supporters are really starting this thing as a pretext for Putin to go in? So how is Congress, what is Congress's role? What do you believe is going to happen? And do you really think there's going to be outright conflict? Thank you very much.
Lisa, terrific question. And obviously all on our minds is the matter of Russia, Ukraine, and kind of the ripple effect. Putin is a very cagey person, former KGB, and he's busy hoisting false flag operations and these kinds of things. So it's very hard to kind of divine what his real intentions are. Now, we've always known what he has wanted to do is basically find a way to recreate the old Soviet Union. I mean, that's really what he'd like to do. That would be his ideal kind of, end game. And obviously, what we're doing right now is recognizing how important it is to constrain Putin in Ukraine, because we will not have, as the president has said repeatedly, we will not have troops on the ground. And having been one of the small number to vote against the war in Iraq, going against what was the clear majority in the polls and the like, I think there were only like 21 of us or something, I think, in the Senate who voted against going to war in Iraq. I think I've always felt it's fairly easy to get into wars and very hard to extricate yourself from one, such as, once again, we learned with respect to Afghanistan. Now, I think the real answer is to have what we call, Senate Democrats, the mother of all sanctions bill, so as to really hit Putin and the oligarchs where it hurts. And basically, with tough sanctions, you can almost make it impossible to pay for anything. In other words, they can't just kind of, haul around, coins from place to place. And the energy sector, its banking sector, Russian sovereign debt, Nord Stream 2, you can really go after Putin in a whole host of economic areas where he will feel the consequences and the pain very substantially. And I'm a supporter of using those sanctions, those economic tools to ensure the sovereignty of the Ukraine. And it really is a high stakes kind of time. The president, again, I'm on the Intelligence Committee, so I'm not going to kind of comment too much on the hour by hour kind of approach, but Putin is cagey, and Joe Biden is very experienced as well, former chairman of the Senate Foreign Relations Committee. I think that this is really the key time to restrain Putin, and he always looks to be at the center of the action. And my preferred choice is the approach called mother of all sanctions, so that he basically is cut off from any kind of economic path forward.
Senator, I think your laptop got bumped a little bit. We lost we're looking at the ceiling.
Are you seeing, I must have been being exuberant when I was talking about economic sanctions. How's that, better?
Yep, we got you back.
Good.
Well, great. Thanks for the question, Lisa. Next up, we have Richard.
Hello, Senator. Good afternoon.
Hello.
My primary motivation in everything I do societally and politically is for the benefit of those most beleaguered, those most injured by poverty, those who are victims of not only governments worldwide, but our own. Professors Gillens and Page in 2014 from Purdue and Northwestern University published an analysis of the responsiveness of our federal government to the people. And their result was that our federal government does not respond at all to people. They respond only to those people who give the elected officials their campaign contributions. Since 2014, I see, and many other people I believe see, that things have actually gotten worse. You use the word oligarchy in reference to Putin and his buddies, but aren't we actually living in an oligarchy here where billionaires get everything they want from our federal government and we the people get nothing? If you look at, for example, dataforprogress.org, the statistics on there, things that have 60, 70, 80% approval from the American public, like a higher federal minimum wage, healthcare for all, stopping wars. By the way, if you were to individually ask everyone in this panel here today whether or not they want more war, I'd be amazed to find anyone in this group who would say yes. So my question to you is, what shall we do about our federal government's unresponsiveness to the needs of the American people?
I think it's a great topic for us to get into early because it will kind of really help shape the rest of the discussion. I pretty much agree with you. I mean, there is no question that the gap keeps growing between the people at the top and the people at the bottom. We have essentially record amounts of income inequality. It's one of the reasons that I proposed the billionaire income tax as chairman of the Senate Finance Committee, because billionaires, unlike nurses and firefighters and middle-class folks, billionaires can just buy, borrow, and die. I mean, the Wall Street Journal put on the front page, if you're a billionaire, you don't want to pay taxes, buy, borrow, and die. And you can do that pretty much for years. Now, I push back every single day against this. Now, you said, for example, that the government hasn't done anything to help low-income people. I'm the author of the proposal that gave unemployed people during the first few months of the pandemic $600 extra per week, each week, and for the first time covered the self-employed and independent contractors and gig workers. Now, we weren't able to keep anything like that going, but it certainly showed what you could do with strong policies like the one I proposed that made a real difference in the first few months of the pandemic that allowed people to get money for rent and groceries. Now, also at that time, we passed a year-long child tax credit, which also was a real lifeline to people of modest means. Recently, it expired. I've gone twice to the floor of the United States Senate and asked that the child tax credit be renewed. I asked by unanimous consent, and one time Republican Senator Mark Rubio objected, and the other time Republican Senator Rick Scott objected. So I think your point is very well taken. I could keep listing, efforts. My Clean Energy for America bill would roll back significantly fossil fuel subsidies and say for the future, the tax breaks are tied to clean energy. You actually have to reduce carbon emissions, and that'll reduce people's energy costs as well. So I don't dispute the fundamental judgment that you're making, and I'm pushing back every day, in every way. And those 4 or 5 examples are ones I'd offer up.
Terrific. Thanks for joining us, Richard. Next up, we have Amit.
Hey, thank you, Nathan. Thanks for arranging this. Good afternoon, Senator. I've actually attended many of your town halls.
Yes, you're a very outspoken public advocate, and good for you.
Yeah, I've come with my family, sisters, McMinnville. I've been working a lot with Ree, Lavanya. But that was part of immigration advocacy. And this question, I really wanted to ask something on that. But the thing is, your press release, actually, after your press release, I thought this was a lot more important. It does tie into my immigration experience, though it took us 11.5 years. We got our green cards in 2020. My family and we have given like medical exams 4 times, the entire family. We have had multiple background checks. Tons of our data is with the US government. And then I read your press release where the CIA newly declassified documents, I actually have it open on a different browser tab. So on Feb 10th, you and Senator Heinrich from New Mexico, newly declassified documents reveal previously secret CIA bulk data collection and problems with CIA handling of Americans' information. So that has me really scared. I mean, I'm an immigrant, and there is a lot of data that the government has. And at this point, I mean, all of the folks on this call, we never know our data is actually being collected. It'll be used to target us for our political views and maybe like any other views we have. So this is something which is very concerning and very scary. And I do appreciate you bringing this out. So do you think there is a way that we will have more transparency with the bulk data collection by the CIA and other agencies like the FBI?
just about to sneeze. I do think that people are very distrustful of government. Excuse me,
God bless you,
my
Senator.
apologies. People are obviously distrustful of government. And one of the reasons I've done 999 open to all town hall meetings is that I think it shows people that there is some accountability with respect to, government. That government is in effect an institution that you can approach. You can approach your United States Senator, you can ask questions, you can hold people accountable. It's obviously better to be able to do it in person. But you've been good enough to come to our in-person town meetings, and let me give you my sense of why this is so important. What Senator Heinrich and I are talking about is a whole branch of surveillance that people really don't know about, and really it hasn't gotten the attention that it should. Is that when the Central Intelligence Agency engages in bulk collection, and this is something that Congress prohibited under the Foreign Intelligence Surveillance Act, what we have been able to determine is going on under an executive order signed by Ronald Reagan, and that is 12333. And this can give intelligence agencies the ability to sweep up Americans' information and run warrantless searches on Americans under the executive order. And the documents show not only does this happen without a warrant or other court order, but the CIA isn't even requiring its personnel to provide a justification for the searches. There's something, little pop-up that takes place, but it says CIA people are supposed to have it relate to a foreign intelligence matter to search Americans, but they don't ever have to write down what it is they're doing. So what we're looking for is a lot more disclosure. We believe a lot more can be declassified without jeopardizing our country's what are called sources and methods. Sources and methods is information. If you give it away, our country can suffer. So our view is, Senator Heinrich and I believe, the law should always be public. Sources and methods needs to be classified in order to protect the interests of our communities and our country. And here there are some very serious questions about what the ramifications are for not leveling with the American people and declassifying information related to this executive order signed by Ronald Reagan, 12333.
Great, thanks for the question, Amit. Next up, we have Jenny.
Thank you, Senator Wyden, for taking my question. I wanted to thank you first for your service to Oregonians and Americans. Your support of healthcare innovation, expanding access to care and insurance coverage has been very important, and your leadership really carries weight. So the focus of my question is on creating opportunities for healthcare innovation at the state level, given the likelihood that national innovation is going to be slow to arrive. The intersection between federal legislation and state legislation is an important one. Oregon is currently exploring opportunities for innovation in healthcare, specifically looking at both a public option and a single payer option. As you know, waivers for federal health insurance requirements will be required for a state administered program to be possible. HR 3775 would allow waivers and open the door on state innovation, even allowing the state to use employer funds for a single payer system. Currently, this bill has only Democratic members of Congress listed as co-sponsors, and it's not looking very hopeful that it can pass. One path forward would be for a similar Senate bill to be introduced, ideally with bicameral support. So I'm curious to know which Republican senators could be influenced on this. Would you be willing to introduce a bill And are there any senators in the Republican Party who stand out as possible supporters of this work?
Oh, let me make sure I understand what you're talking about, because I'm very supportive of state innovation being used to expand coverage and hold down costs and increased access. Now, were you aware that I got a provision into the Affordable Care Act that allows for a very broad swath for state innovation?
Yes. I think there are still some restrictions, though, on how employer money that goes towards healthcare can be used.
Yeah, let me walk it through, because I wrote that provision because we feel very strongly in Oregon about expanding access, innovation, and if the federal government just give us a little more breathing room, we can do a pretty good job. That's kind of been our philosophy. Now, the waiver that I got, and we'll direct everybody to the specific section of the bill, basically says you can do whatever you want as long as you meet the coverage requirements of the Affordable Care Act. In other words, the state can't get a waiver and then take the money and, have all the, the management, go off to Honolulu or something on junket. You have to expand coverage. You have to meet the guardrails of the Affordable Care Act. Now, I think what you're talking about, I may be kind of tying two areas of the law that really shouldn't be tied together. But I think you're talking about ERISA issues, which involve employers. Is that right? Employee Retirement Income Security Act, and pulling them in to this. I'd be happy to work with you on ways to promote waivers. I don't think it's quite as easy as just putting them in an innovation bill, because you would have to have a specific set of reforms and probably have to change some ERISA requirements. But I'd be happy to work with you on it. A, I'm for a public option, certainly. B, I'm for expanding innovation waivers. I think Medicaid is a particularly fertile area for new public-private partnerships, because that's a federal state program. And you may have seen that we're doing a lot of work on mental health, and I was able to take the program in Eugene called Cahoots, and I got it put in the American Rescue Plan into Medicaid. So there's an 85-15% federal share for that. And I think what I can tell you about it is Cahoots at the federal level, Cory Booker likes it, good progressive news, but Tim Scott, the conservative from South Carolina, he likes it too. So we ought to pursue these innovation waivers, and I'll be glad to work with you on the business side as well. The reason that we didn't put ERISA in specifically in the ACA was it just looked like it was too much to get a waiver measure passed. There have been objections probably even from the Democratic side.
Great. Thanks for the question, Jenny.
Good work.
And, Jenny, we'll pass your contact info along to Senator Wyden's staff so they can follow up. Next up, we have Bob.
Hi, Senator Wyden. Thank you for doing this today and for all the hard work you put in. My question relates to the recent spate of disturbances on airlines. And there's been, I think, somewhere in the near amount of 6,000 in the past year. Some of them not too severe, maybe. Some of them very severe. And recently, there were 8 senators that signed a letter to Attorney General Garland opposing a universal no-fly list for unruly passengers. And from the gist of reading the letter, basically what they're saying is they're merely expressing themselves about mask mandates, and they shouldn't be penalized for a universal no-fly list. Regardless of the reason for the disturbing behavior, the extreme activity has created unsafe conditions. And I guess the question is should a universal database be created for all the airlines, as the CEO of Delta has requested? Should it be permanent or should it be temporary as long as the current conditions about mask mandates and other things apply because of the pandemic, and who should create this universal database, or who would be responsible for the creation of it? TSA, the FFA, the Attorney General, but most importantly, without having to deal with recalcitrant members of Congress who would obviously never see it passed. Thank you.
I mean, you're obviously talking about a significant problem. We've seen this huge increase in incidents on board flights, and the FAA has introduced a zero tolerance policy. There's big fines on passengers that have disrupted flights. Individual airlines are banning offending passengers from future flights. Creating a universal, database certainly raises, in my mind, some, privacy issues. Are you going to give it to a contractor, for example? You probably heard the news that I led the effort. It was successful to get the Internal Revenue Service to give up the requirement that people submit to a selfie in order to access various IRS, functions. So I'm a real privacy hawk. I'm a privacy hawk who also believes it's a dangerous world out there, and smart policies protect your privacy and your security, and not so smart policies don't protect either particularly. So I'm gonna want to know a little bit more about it, and I take safety on airlines very seriously. I've supported the zero tolerance policy, the big fines on passengers, individual airlines banning offending passengers from future flights on their aircraft. And I'll just have to give a little bit more thought to the nuts and bolts of a universal background check. I'm particularly concerned about the idea of using a private contractor, as is the case with ID.me, and I blocked that.
I agree. You shouldn't use a private contractor. The TSA already has a so-called universal no-fly. Couldn't that be piggybacked off of that?
Well, that's the question. There may be ways to do it, and I'm just going to have to spend some time thinking it through before I shoot from the hip.
Thank you.
Okay, thank you. Good question.
Yeah, thanks for the question, Bob. Next up, we have John. John.
Hi, Senator. Can you hear me okay? Or
Yep.
can everyone hear me?
Yeah, we can hear you.
Yeah, there's John.
Hi. Thank you for taking my question. My daughter is 19 and suffers from lifelong profound autism. And for the past 2 years, what limited support she received under IDEA has, I'm going to say, effectively disappeared for obvious reasons. And it's also become very difficult to find appropriate in-home, residential, or in-community caregiving providers and services for her via the Medicaid waiver program that she's supported by. Now, I believe you're a co-sponsor of the latest attempt to fully fund IDEA at the federal level.
I am indeed.
Yeah, and while certainly necessary, funding alone I don't think is going to be sufficient to really rescue my daughter and others like her from the situation that they're in right now. So I'm interested to know what immediate improvements.
Well, John, back
IDEA
it up. If you think extra funding won't do very much, tell me what you think really would help your daughter.
I didn't mean it that way. Funding is certainly necessary, but alone, I believe, would be insufficient to rescue my daughter from her situation.
What's necessary to rescue? What's necessary to rescue your daughter?
My immediate improvements. I'm asking for what are some immediate improvements, maybe the IDEA and maybe Medicaid waiver programs that you think are needed, and are there specific changes in addition to fully funding IDEA that you intend to prioritize and pursue? I do have some specific suggestions of my own.
Let's have yours, because I think the biggest problem is that for years, there's been a lot of lip service paid to ensuring that there was enough money. I mean,
Yeah.
the waiver structure for IDEA is set up to encourage innovation. In other words, the theory is I and others didn't say, hey, great, let's just have the United States Congress throw a boatload of money here to see if these vulnerable people will get some help. The idea was, we'll spend some money, but we're going to spend it on trying to get waivers and innovations and deal with, actual problems. And I'd be very interested in hearing. You don't have to write a bill. Just tell me a couple of things that if they were included in IDEA, it would make a difference for your kid.
I'm not sure I understand your question in terms of specific
John, here,
innovation.
let me state it this way.
Yeah.
You said it wouldn't just be money that would
Oh,
help
yeah.
your daughter.
Yeah.
So if you can tell me a couple of things that would actually be helpful to you, I'll walk it through the system and see if I can have some exchange with you.
Well, one of the challenges of IDEA as it's currently implemented, I believe, funding aside, is that it puts a lot of, I'll say, burden and effort on the parents of the special needs children to identify, secure, and monitor services and programs specifically targeted for their child's needs through the IEP, right? I mean, you're talking about a community of parents who are not experts in speech and language pathology, occupational therapy, behavior therapy, even academic skill development, right, for these children. And yet we're supposed to be part of a team to sort of craft and negotiate individually targeted plans and allocate appropriate services to them with teams from the school. So whenever the parents feel that the students are not being served properly and they're in disagreement with the school side of the IEP team, they're left without recourse except to sort of go through, in my experience, a rather bureaucratic appeals process that often leaves them unmotivated or demotivated, right, to do anything more than go along with what the school side of the team recommends and execute. So in that regard, one suggestion would be having maybe OSEP take a stronger role in, monitoring and performance managing the state's application of IDEA and the school districts through them, right? I feel that there might actually be a bit of a structural issue right now with how things are implemented, just again, through my own personal experiences. And the acute problem that I and many of other parents of children like mine face right now is that my daughter's 19, as I mentioned, we're aging out of the IDEA system. And what limited support we've gotten over the years is about to end. And we're about to enter into the adult services side, the Medicaid waiver side of the program, right? And those, I think they're called HCBS services. Those, as far as I can tell, are really struggling right now. Like a number of residential facilities in Oregon have shut down. A lot of the day programs are not set up to deal with the most severely disabled adults coming into their systems that have emotional and behavioral issues that make them, quite frankly, unsafe, right? And therefore expensive to care for. So I'm equally worried about the system my daughter is about to enter into. So in that regard, I'm looking for anything that you and Congress could provide to improve the quality of IDEA implementation. And because of the I want to call it the cliff in support you get after you age out of IDEA, right? Extending IDEA coverage at least for a couple of more years and increasing the mandatory coverage age to around 23, so that kids who are about to age out, you know what I mean, just don't fall through the gaps.
Right.
And I'll stop talking. I'm sorry.
No, they're very good points. And for your daughter, as she gets older, you're concerned about home and community-based services.
Absolutely.
Well, you may have heard Senator Casey and I and others are trying to pass a bill that would professionalize help for those individuals.
Yeah.
So that's part of what we hope will be a version of Build Back Better. That I know about.
Is there a way to help these service providers be a little more financially stable so that economic downturns and pandemics don't completely derail their ability to stay financially viable and hire and train staff?
Not only is it possible to help those programs stay in business, we could professionalize this workforce. Right now, as you know from dealing with this, you have somebody who's fairly young, fairly inexperienced, isn't going to be there very long. It's not a profession to work with this particular group of vulnerable people. So for the adult age, home and community-based services, with a little bit of luck, is coming. I hope it'll be sooner rather than later, but I was in a big meeting with Senator Casey just yesterday, in fact. So we're pushing very hard on that. With respect to your daughter's situation, really younger and under 19, we can go that route of having another operation. You called them the OSEP people and the like, work with your daughter. One of the things I've been thinking about, apropos of home and community-based services, is it'd be great if the government would at least give some training to the parents. So the parents of a younger child would actually get the fundamentals of being able to advocate for their kid as they go the gauntlet through various agencies. But I feel very strongly about this population. I think that this is part of what government ought to be doing, is saying that youngsters like yours are not just going to be set aside and shunted aside. I mean, we're better and stronger than this. You're obviously a dedicated parent. So I hope that we can be helpful in kind of two areas. One, seeing if we can give parents, should they want to, the chance to get trained so they could do some more to advocate for their kid at a younger age. And then on the older child's home and community-based services, I think we can get that. If it doesn't happen tomorrow, it's going to happen.
Great. Thank you very much.
All right. Thank you.
Thanks so much for the question, John. Next up, we have Bing and Janelle. And I believe Janelle is a high school student. So glad you could join us, Janelle.
Hi, Senator Wyden.
Hello.
Yeah, people in Oregon know you are the senator that listen. Thank you very much.
Thank you.
Yeah. My name is Bing Theobald. I'm a naturalized citizen and a community organizer. As the leader of our community, I have attended multiple funerals related to mental illness. Even before the COVID, Oregon mental health ranked the worst in the nation. A quarter of Oregonians have some sort of mental illness. COVID has made things worse. My daughter, who is also sitting in this meeting, was born with mental and physical disabilities, which including autism. She went through depression in her teenage years. Luckily, we have resources to help her, but many people don't. Mental health care is so oversubscribed that many providers don't join insurance networks. My daughter actually founded a nonprofit to advocate for people with disabilities and mental health illness. And she worked with a capstone program to create a pioneering idea that might improve the situation in Oregon and in the nation. Like I'll let my daughter add a few words on this. She knows more details. We would like to know how you and the Congress are working to address the mental health crisis and how she could help, whether by testifying in front of the legislature, working with government commissions, or any other ways.
Very good and very, very important topic. Probably the real sleeper issue for this Congress. We were in bad shape before the pandemic on mental health. The problem has mushroomed dramatically. I have put the Finance Committee, where I'm the chairman, on this issue. We're working on a very significant package. The Republican senator who leads the group, Mike Crapo of Idaho, is with me all the way, because we both see it, he in Idaho, me in Oregon. The Surgeon General told us a week ago that it is now on average 11 years between the onset of treatment and actually being able to get cared for by a provider. That is absolutely unacceptable. We would never expect that to be the case for physical health. If you had a heart problem, you wouldn't wait 11 years to see somebody to talk about your heart problem. So a couple of things. One, you mentioned the insurance companies. There is a law that says they have to give parity to mental health as well as physical health. I believe the insurance companies are not complying with the parity law, and I'm going after it. I'm going to go after it so that they do. There's really something out of whack when families and colleges and others can't get bills paid for months and months on end. Real questions in my mind about whether parity is being complied with. Second, we're going to be focusing on earlier intervention, which is what the doctor was talking about, where you just have particularly a young person not be able to get care for years and years on end. It becomes very serious. And third, we're going to focus on crisis care, because right now, a lot of young people, there is no bed for them when they're in crisis. They go to the hospital emergency room, where, as we were told this week, there are a lot of people who aren't trained in mental health. So we're going to be focusing on insurance companies doing a better job for the patients, earlier intervention for the young people, and better crisis care. Those three things.
Yeah, I'll let my daughter add on, like what, like she work on and those details. She's thinking about how to improve those situations.
What year in school is your daughter?
Janelle, are you with us? Are you able to join?
Yeah, I'm here. I'm in 9th grade.
Well, you can see in the hearing that we held in the Finance Committee, Trace Terrell, who is a senior in Lapine, Oregon, said that at his school, 80% of the referrals from the school to mental health providers just go unanswered. Simply nobody is answering them at all. That's completely unacceptable, and we're going to focus on that too.
Janelle, did you have a follow-up question or more you wanted to add?
Yeah. So first of all, I'd like to thank you for holding this town hall.
Thank you.
Very important. And recently, one of my classmates committed suicide. We all know people with mental illness, friends, relatives, classmates, colleagues, or neighbors. The mental health problem has been largely overlooked, and it's clear that our current solutions just aren't working. I'm presently trying to get some new systems implemented, ones that would involve the community and not just rely on limited healthcare professionals. I'd like to get an opportunity to talk with you I know you're not on the health committee, but you're recognized as one of the Senate's foremost health policy thinkers. And this is a very serious problem, not only in Oregon, but also in the entire nation. It's important to implement a solution as early as possible so that we can help this huge percentage of people. And if the opportunity arises, I would like to testify about this in front of Congress. So currently, I'm already on the ADA Technical Advisory Committee, as well as being involved in several community projects. But this is my passion, and I would like to do more. So my question is, how can I get further involved in this, and what opportunities exist for me?
Your first name is Janelle.
Yes.
I'll make sure that our folks from the committee are in touch. The Finance Committee has jurisdiction over Medicare, Medicaid, the Affordable Care Act, the Children's Health Plan. We pay, our jurisdiction funds most of American healthcare. So we had the second of a number of hearings with Surgeon General first, and we had a student last week, Trace Terrell of Lapine, Oregon, who I just talked about. And we're going to have students in the future. So we will reach out and call you. And I would very much like to have your input. I want to have Oregon students at the table on this mental health issue. This is something that affects people in their living rooms, in their kitchens. Business as usual is unacceptable. And we'd very much like to have you involved in. You just give us a phone number and an email and we'll be in touch.
Okay. I guess I'll just send that to you in the chat.
Yeah,
No, if
we'll make sure that his team gets your
Janelle,
contact info.
Janelle, if I get your number and you can give it to Nathan, or you can just get it to us directly, I'm online, we'll call you in the next couple of days. We're looking for more Oregon young people who would like to be directly involved. So your call is very welcome. And if you just go to our website, you'll see the testimony of Trace Terrell, who is a senior in Lapine, Oregon, and he did a terrific job, and the senators really appreciated it.
Great. Thanks so much for joining us, Janelle, and we'll make sure you get connected. So we have a few minutes left, and we're going to try to get to a few questions submitted online. We might not be able to get to everybody's, but thank you everyone who's been contributing to the vibrant discussion in the Facebook comments. So we have a question, Senator, from Trish in Tigard, who says, my question, Senator, is what is being done to address the donut hole? I have one breathing med which forces me into the donut hole in August. Amounts were set way before current prices. Thank you.
The donut hole, for those who don't know about it, is the hole that reduces coverage for those on Medicare who really have big expenses. And the biggest thing that's happening is, first, in our legislation, we would have a copay cap on some of the most expensive drugs, particularly insulin, which is very important. There's a copay insurance cap on insulin, which is used by thousands and thousands of Oregonians who have diabetes. And for the longer term, we're going to lift the restrictions so that Medicare can negotiate to hold down the cost of medicine, which is also very critical. And third, I'm really cracking down on this government process of granting accelerated approval for drugs, which can be very important, particularly as we look for cures. But then we've got to make sure there's the clinical work to make sure that they're effective, because otherwise you can have drug companies just coming in and saying, I have a cure for something, and you have to put a higher charge on Part B premiums for me because of my spectacular drug, and nobody ever determines if the drug is working. So those three things will all help people who are faced with the donut hole.
Great. Well, thanks so much for the question, Trish. We've got a question from Sue, who asks, Senator, quote, why do you support masks when politicians and celebrities frequently go out and about without masks?
What I would tell you, a very important question, and thank you for asking it. I've always tried to be as consistent as I possibly can. For example, I'm sitting here now on this virtual program, talking to all of you because nobody is within 6 feet of me. And I actually have my mask right here, ma'am, so that when I'm done and I walk out next to people, I'll have my mask on. So your point is a very good one. I'm glad you asked. I mean, these are very difficult issues. And Nathan, if I could, let me just mention one thing that I do feel strongly about. And I've thought a lot about it. And I've talked to people on both sides of all these issues. And, you know, reasonable people can have differences of opinion. That's why we have community meetings, is to talk about these issues. I just want everybody to know it is my strongest hope that everybody in Oregon who can get vaccinated, do so, because I think that will be good for our people and our communities.
Great. Well, thanks for the question, Sue. We have a question from Stephanie in Forest Grove, who says, quote, 50% of the homeless population have a traumatic brain injury. Most have what is called a trifecta diagnosis, TBI, addiction, MH. I believe MH would be mental health. Yet there are only housing facilities available for dual diagnosis. With limited services for mental health, no services available for traumatic brain injury, and extremely limited housing, there's little room for housing for a person with trifecta diagnosis. Where are these people supposed to go who are living on the streets and have extreme mental health issues from traumatic brain injury and or substance abuse?
The person who's raised this question is discussing something that's very important. I give a lot of thought to it. A big chunk of the problems that we have on the streets really have mental health roots. My brother suffered from schizophrenia. He has passed. There were years in the Wyden household when we went to bed worried that he was going to hurt himself or somebody else. So I'm very much committed to solutions on these mental health issues. I think you heard me talk with Janelle and several others, or Mom, about our work. And if you'll give us a phone number and an email, I think the issues you talked about are particularly important, particularly complicated, because you're talking about folks who have multifaceted brain injury. In those cases can be very, very difficult. And as far as I'm concerned, when you have difficult cases, you also deserve fair treatment from our country. I mean, we spend $4 trillion a year on healthcare, and we can do a lot better job. And one of the areas we can do a better job in is mental health. I mentioned the insurance companies. So if you'll get me that information, we'll be glad to follow up with you. And I'm glad that you've called and raised the point.
Yeah, thanks for the question, Stephanie. And we will do our best to connect you with Senator Wyden's team. So last question we have time for, and do apologize we aren't able to get to all of them. Some really great subjects raised in the comments. This is a question from Ruth Ann. I'm going to paraphrase a bit because it is a longer question. Ruth Ann is asking about the Postal Service Reform Act that has passed the House and seems to have been held up to some degree in the Senate. Senator Wyden, if you have any update on that and how you plan to vote.
I got an update, and I think it's just outrageous. So this is a bipartisan bill to help the Postal Service get out from under something nobody else has to do, which is to come up with a 75-year kind of retirement, package, in effect, planned today for funding for 75 years. It really is, unreasonable. In the House of Representatives, Democrats and Republicans came together and passed legislation that was bipartisan, that it's going to help us put the program on a better track, give the Postal Service a chance to get into some new activities have more flexibility. And apparently, Nathan, there was one itty bitty technical error made in the drafting of the House bill. So when it came to the Senate, Senator Rick Scott of Florida, who doesn't like the bill, basically objected on the grounds that there was a technical error. Well, I can tell you in my time in public service, those technical errors get corrected automatically, absolutely automatically, like within an hour. And so I think it's very unfortunate that Senator Scott is holding up for all the people in this country who depend on postal services, that we're not getting on with the job of reforming the program. And this was not a substantive difference of opinion. This was what Senator Scott admitted was a small technical error, but apparently he doesn't like the bill. And so the country has to wait for reform. We are going to get this bill passed when we get back. Count on it. And Democrats and Republicans want to get it done. It's not right. And, you know, I watched these kinds of things many, many times during the period when I've been honored to represent Oregon in the United States Senate. And I don't remember another example that was this kind of flagrant, where nobody was saying that this was a substantive error. It was a technical, small technical error, not anything relating to the substance of the bill. And it's too bad the bill isn't on its way to the president's desk as we speak. And I'm going to do everything I can to get it to the president's desk.
Great. Thanks for the question, Ruth Ann. That is our time for today. I just wanted to remind folks that, as Senator Wyden mentioned earlier, this is Town Hall number 999 for him. People's Town Hall has not been around for all 999, but it's been our pleasure to be hosting these virtual town halls recently. And we will be back with Senator Wyden this coming Thursday in Lane County for his 1000th town hall. Senator Wyden, thanks for joining us today. And if you have any closing remarks, take it away.
Nathan, just like yesterday, this has been another shining example of good government in the Oregon way. We've had a number of callers, not a bad question in the House. And, you know, obviously there's a lot of heavy lifting to do on important issues. That last question about mental health as it relates to people who have suffered brain injuries. These are serious. This is an area where government is going to have to figure out how to bring people together and come up with some fresh ideas. And I just want everybody to know that I don't have all the answers to the issues people have brought up today. But what I will say is that nobody has all the answers. And the importance of meetings like this is they give us a chance to kind of sketch out some possible paths forward. And I very often get ideas and suggestions from these. And a couple of days ago, we were able to help some folks who we got wind of having problems in Toledo, Oregon. You know, the IRS was going to put them out in the cold from their rental housing, and they hadn't done anything wrong. It was somebody who owned the place who'd been involved in some illegal activity, and yet these people were going to be blamed in violation of Oregon's tenant protection laws. We got it straightened out, and now the seniors who live there, the young people and others are going to know that their government moved to actually make sure they get a fair shake. So that's how I see my job. Sometimes it may be legislation. In that kind of instance, it was a busy day. I said, I'm chairman of the Senate Finance Committee. I'm going to get the Internal Revenue Service Commissioner on the phone. And we did. And that day we got it fixed. So there's a lot of reason to be skeptical and distrustful of government. And what I want everybody to know is the reason we have these meetings is because we understand this. We're doing everything we can to make government more accountable and more responsive. Washington County, great job. To be continued.
Thanks, Senator. Thanks, everyone, for the conversation. We'll see you next time. Bye-bye.